the modules, but everybody thought it was a good idea.
Great. It is. We've been doing it, and it's really good.
So sounds like it makes a lot of sense.
Yep.
Just need to get going on it.
Okay. Region 5 is Rescue 7 and 8. We're busy with calls, busy with our new truck and getting things in order. We have Dive has gotten 4 new members from the sheriff's dive team, which we're really glad to have. And both teams have gotten a few members from out there in the public, which we really need. Okay. Chairman's report. Committee reports. Tammy?
Okay, the training committee had a meeting on November 10th. The members of the committee right now are Zach Smith, myself, Mike Carroll, Bruce Brock, Nat Mann, and Eric Sprogus. We talked a little bit about what we were going to do, sort of just try to throw out some ideas and brainstorm some. We're going to look at maybe trying to set up some kind of schedule that can be followed throughout the county to sort of make it where if you miss training somewhere, you can go somewhere else to get it. If you don't have the action training capabilities. And just making sure that everything is sort of standard across the county as to how training's done, possibly even having some lesson plan type things with objectives of what needs to be covered during that particular training. Like I said, we talked for about an hour and 15 minutes and just sort of mulled over some ideas and some things, and then we're going to meet again on December 8th. And Ray Smith will be joining us for that meeting, so.
Good. Okay.
Good start.
Yep, sounds like it. Michael is in the future planning. Has that met yet?
I haven't gotten an invitation or anything on that presently.
Okay. I'm sure he'll let us know next month. And the Communications Committee has met a few times. And we're moving ahead with improving the digital system in the county. A letter is going to go out soon to all the rescue and fire chiefs, mapping out the types of radios that are going to work in our system, approved places where they could buy the radios. And there are a number of rescue squads and fire departments that want to put in their own repeater to make their communications better in their area. We've recently found out that those areas may not need a repeater, maybe just a voting receiver. And if that works out, that'll be less money. So that's all moving ahead. Oh, the other good thing about the voting receiver is don't need an FCC license. We got approval to use the Salem water tank as a place for a repeater. Brian is looking into the BASF water tank. Chris Belcher from the Sheriff's Department has joined and will be helping out with Travis Tilson. We're working on getting up the code plugs for radios. It appears that we're going to have 4 zones depending upon where you are in the county. And all these zones will all be the same in every radio in the county. And when we go to mutual aid to help other departments and squads, one of the things we'll do is automatically go to that zone, so we'll have all the channels for the communications. Those zones will also have specific mutual aid channels, like in Georgia and North Carolina, Anderson County, Hartwell. Plus each department will have as many zones as they need in addition to the 4 zones that they may want special frequencies. Anyway, that's it on the radio committee. Fire departments in the county that act as rescue squads were once invited to have a representative, the chief or someone who can vote for his department on matters that have to do with rescue. We wanted these people at the rescue chief's meetings every month. And that happened for about a month or two, and then it stopped. And we really don't have ways of communicating what the chiefs are doing or want done with the fire department, so there's no open lines of communications. And I was wondering what my fellow representatives have any suggestions about that.
Isn't there a new fire chief that's gonna be starting? He can be brought on board to make sure any fire stations running rescue calls would be able to attend? Is that something that sounds like it'd be in his ballpark?
So yes, we do have a new fire chief. He will get started later in December. But yes, the biggest thing is the fire departments are fire departments running medical calls. They're not rescue squads. But your committees in the county's policies on how you respond to medical. So I would encourage them to be a part of your conversations, because medically, they're going to be responsible also. Just because they're a fire department doesn't mean their training is any different for medical than a rescue squad member for medical. Just like if a rescue squad has a fireman, his training is no different for a fireman. It's all the same. So I would always encourage, and we can get with Chief Greer as it moves forward to emphasize the need, is if they want to have a say in how those things are, that they be a part.
Yeah.
Good, okay. A few years ago, we started getting training in wound packing for GFWs and knifings, but we're not dispatched to those. I was wondering what the feeling is about not being able to serve our community in that area.
Well, the one thing is you're not sent to a call that requires staging, because EMS is being staged outside close. We can reevaluate that, but in general, that's why you're not being sent. We are first responders, and there's no reason to send us first responder when I already have an ambulance, a paramedic sitting there waiting on a police officer, or if the police officer may already be there to go into a possible dangerous situation. That's why we're staging them. So the word first responder means we should be first. If we're not first, we don't need to wake up volunteers when there is a paid person physically doing that. If it's bigger than that, yes, you would still get sent, but we also have to look at the danger of going into a gunshot, into a stabbing or anything like that. But that's why that decision to not send responders to those was made.
Yeah. However, my opinion would be to continue having that type of training, because you never know when you may walk into a situation where something like that's occurred around you, and it'd just be nice to know how to act. You certainly don't want to be sent into one, but if I just happen to be on the street and somebody is knifed or shot, I'd like to be able to, as a responder, be able to know what to do.
I think the Stop the Bleeding program and packing that we've talked about in the past, or done in the past, is a great program for everyone. We taught a Stop the Bleed class here
Right.
for non-responders because the possibility of us being involved at any one time accidentally and knowing what to do is important. So again, I agree with you, sir, in that we need to keep doing the training, but that doesn't mean we need to put responders in danger. Just because we have training does not need to mean we increase the risk to responders.
Agreed.
Thank you. There also seems to be an unwritten rule that when law enforcement, whether it be highway patrol or another law enforcement, requests medical, that responders are not sent, no matter what kind of call it is. I was wondering if we need to do something about that, if we need more training. I don't know where it's originated.
I will ask for the policy in that. Off the top of my head, it goes back to that first responder thing. They're first responders already, and so if they're calling for an ambulance, they need an ambulance. They don't need another first responder. But I'll have to look exactly what we set a rule or whatever for dispatch in that. I don't have that right off the top of my head what that is. But in rule of thumb, if they're calling for an ambulance, they're calling for an ambulance. We aren't an ambulance.
Okay. Chief Scott's report. Chief Grimes' report.
COVID-19 update. So we all know that unfortunately our numbers are heading in the higher numbers quickly. We're inside more. We're doing all that. We need to please pass it to your squads to please wear a mask on every call. Okay? Wear a surgical mask on every call at minimum. If there's a thought because it's a cold and flu or whatever, it's okay to wear an N95 to protect yourself, because we do not know the difference between the cold and flu and COVID presently unless they've been physically tested. So we need to make sure people are appropriately doing that. Cleaning, testing, all those kind of things. Testing. We are in the process of bringing responder testing, which is going to be for police, fire, county, local, state. Anyone, any responder in a Coney County will be able to come to that testing. At minimum once a month. We're looking like we're going to have that twice a month. We're going to encourage it, not require it. At this time, we want people to test and protect their families to make sure we're not taking it home. But we're working through that process presently through DHEC so that we will have a time that it will be for responders to come in. Hopefully, for hours in a certain day. We're going to try for some alternate hours. But we are also dealing with a contract through the state. So we can do some things and we can't do others. So we're navigating that as it is, but to bring that in. If we don't have enough responders that want to have that testing, our thought would be is we're going to open it up to the public also. I would rather have it available for our responders and the public than us not to have it if we don't have the numbers. We know that DHEC ran out of testing the other day for a few hours at their site here. So the more testing we have available to test more and try to make sure we're identifying those that are at risk before we spread it, or at risk of spreading it before we spread it by going on a call. We have a lot of healthy responders that accidentally could not be sick and be spreading it because we just don't know. So we're going to encourage that testing as it moves forward. We'll be getting information and emails out as that comes about and what it all entails. We had a conference call with the vendor and trying to literally kind of hone all that down as we go through that. Vaccine possibilities, that's exactly what it is. We did have a brief on that. There's a lot of variables and who and what, where and when and all that, but we hope that will be solidifying soon. and coming through. We are trying to work through to make sure we are sitting in a position as best as possible to provide that if the county was to get allotted some of those vaccinations for first responders within the county. We have requested that, but that we're not guaranteed that. We have requested it for those that want to take the vaccine when it becomes available. And that is, we don't even know which one of the possible three that we may get and what all of it entails. So there's still a lot of loose ends, but we are running down that possibilities and making sure that we're prepared and preparing ourselves to make that happen if it was to come about. Mentioned it briefly in the COVID, but responder PPE and safety. I think it's very important, number one, that we make sure we tell all of our responders, fire and rescue across the board, if we are at a motor vehicle accident, we have to have a reflective vest on. Even if you're standing off the road, if we are out of our vehicles, we need to make sure we are prepared for someone not to see us. And so any reflective vest or anything needs to be appropriately worn for that, as that is a definite safety requirement for that. Again, with the masks, make sure we're protecting ourselves. Just all of us earlier being masked up when we're in close proximity, those kind of things make a huge difference in emphasizing if we lose 50% of our responders on the volunteer side, that's going to be awful. And for a week or two that they're quarantined, that can be very detrimental to our capabilities of response within Macomb County, as we know. So just another quick reminder to make sure that they're appropriately doing that. And if you're having a problem with those items or anything, please let Mike know, and we will work on making sure that the appropriate equipment is provided for you. Responder opportunities, we have some things coming on for clinics and those kind of things that we will be sharing in the near future. But what I want to encourage our responders is we have a lot of times just been making it on the response side because the call volume has been so high. But at one point we had departments having open houses with clinics and those kind of things in there. We need to just still push that information out. So we need to start making sure we push a good message of good health and cleanliness, cover your cough, wear a mask, those kind of things on the squad level also. Before COVID, when we could have people in the station and we did blood pressure checks to get our squad's names out there and a lot of those things, though we shouldn't be gathering in large numbers and those, it doesn't change that we still need to have a good positive message. We need to still message for the safety of the public on good health techniques and those. It's flu season, okay? So we now have COVID and the flu, and we're going into the winter when we get the sniffles. So making sure that we are pushing a good message out to our members and our constituents of any citizen and everything, make sure that we're doing that appropriately and kind of get back into the prevention possibly on the side of the responders. If it be special needs, we're talking about that again, about the home visits and those kind of things for the special needs populations, knowing what your population is if you had to treat them as it goes through for that. So taking opportunities that we can and do that education that might keep us from going back again is important to limit the number as our growth of calls is exponentially growing at times. The way to stop an exponential growth is education in a lot of cases. So if we could work on that and I don't have all the solutions, but we have a lot of great responders and great minds that getting together can pull some plans together to say, hey, here's something we did to help somebody and it reduced the calls that we have. And so I just want to take that opportunity to try to, as you're out and about in the squads, please remind them, we have been overwhelmed with calls and we thank them for running everything that they do. But maybe we can reduce some of those by some education.
I heard a fire department recently talking about they had someone who really needed a wheelchair ramp, but they felt that they couldn't supply it because it was of liability.
So
That's a shame that we can't do that.
So we are working on some lists for groups that are 501(c)(3)s that already do that, with medical equipment, some other options. So when medical equipment is donated, that they can make sure that they get to the right people that need it. Hospital beds, people that don't have the money for a hospital bed and need one. Those kind of things we're looking and making sure we have a group that we know can do that for when we have those needs, because we are seeing a lot of that going on. And so know that there's opportunities for all of the squads to be a part of that as a 501(c), to say, hey, we can make that connection. Sometimes, especially when our lift assist, it's the correct walker, or it's a wheelchair or a lift bed, whatever that may be. A lift chair helps people get from falling. If we can connect those dots of the organizations that provide those or can help people in those situations.
Is Mike spearheading that?
Mike is starting to work on that.
So we have someone we can go
Yeah.
to Mike?
Yeah, we're starting to work on that. There is a list already made for the organizations that we're trying to update. It hasn't been updated in a few years, so we're trying to get through that. And with that, try to expand that program for the squads to help in the future.
Okay. Anybody else have anything? Tammy?
Not that I can think of.
Eric?
Me neither.
Stephen?
Sounds well covered.
Okay, good. Well, we're not having a meeting next month, and we'll see everybody in January. If no
Sounds
one
good.
has anything else? Anyone like to make a motion to adjourn?
I'll make a motion to adjourn.
I will second it.
All in favor? Aye. Opposed? We're adjourned.